health sector goes paperless as the government, through the Health Ministry, is set to roll out an e-medical record and patient management system in the country called the National E-Health Project. It is expected to, among other things, have a centralized data center that will network all hospitals and clinics and community health centers in every sub-district in Ghana. We'll bring you excerpts of the launch, but before then, my colleague Matilda Womega has been looking back at how we've managed our health records for many years. So I can do a scan.
For that system, as we've always been experiencing concerning the long queue and other things, because the stress in it, getting your folder stuff, you'll be in a long queue. But if they move into the electronic system, I think that one will be a little bit easier for us.
Okay, one major concern is about the long queues one has to go through before getting the folder. And sometimes you find your folder is missing and you would have to do a new folder and all that. This delays the time. Most of the hospitals would like to see the folder before they even attend to you, which I also think it's one of the major setbacks using the folder system.
In this room, as you can see, there are over thousands of folders belonging to patients who visit this hospital here. All these folders are kept in this room. But from what you can see, most of these folders are coming out of the shelf, meaning a lot of them are unable to be kept here as a result of the increasing number of patients they see to every day. In this room, it is dark. I've been here for less than 10 minutes and I'm already sweating. It's a bit stuffy in here. So you can imagine what the record-keeping personnel go through each and every day trying to get folders belonging to patients here at this facility. We've spotted one of the personnel who is busily going through the folders trying to locate a patient's folder here. Let me try and get to her to get some understanding of what they have to go through each and every day to locate a folder for a patient. I'm wondering how they get to do this. Cynthia, I realize you are busy, but sorry for interrupting. I realize you are busy looking for a folder. How do you do that?
We have the folders coded by numbers. We have each year and the numbers that they go according to. So we file them into the columns. We have 10 columns, that's 0 to 9. And each year has a column that we file into. So we have a patient gets a unique number with the system. So we use the unique number to search for the patient's folder and retrieve it for the patient to go and see the doctor.
So you segregate them based on the year that the patient first visited this place. I'm wondering how you do that. Because you see a lot of people in a year. And how are you able to tell, okay, so this person came in January, this person came in March? Is it segregated based on monthly basis, or how do you do that? Is it alphabetical? How do you do that?
We use it by the numbers. We have the numbers, the code, 7 numbers with the year attached to it. So as soon as each patient have that unique number, every patient have that unique number, so they are different in all. So no one has 2 numbers. No 2 people doesn't have the same number. Okay. So as soon as you see the number, you use the number to search and retrieve the folder for. So I know this is the ID card of the patient. So it's year 15. Okay. I know it's around this area. Okay. So as soon as I pick this is the hospital code, and this is the patient's unique number. Okay. And this is the year. So I start checking the year. I know it's around. I automatically know 15 is here.
15 is here.
It's here around this area.
And everybody in that records room know where 15 is kept.
Where 15 is kept. Unless you are a personnel that is coming in, we teach you how to pick it. So with time you get conversant with it. Yes, so that's how it works. Then I start searching for the first 3 numbers, go to the fourth number, 001. Okay. So I just, with that one, I won't know where it is. Okay. But I just pull this one out. You see it here, 15. Yeah. By 002. Okay. So this is column 8. So I pull back
How long does it take you to locate a folder?
Like 5 to 10 minutes.
Are you sure you're able to go through all this within 5-10 minutes?
5-10 minutes.
Some of the folders are out of the shelf, some are scattered.
Those that are in the shelves belongs to patients, but the ones on the floor are dead folders. The patients are already dead, so we keep them on the floor.
Do you burn them? How do you discard them?
No, they are being taken to the archives.
Okay.
But we have to wait for a while for the patient to come, the relatives to come back for the documents, like the death set for the patient.
Present it here,
yes.
And then So you've seen it all here at the records room. You've heard it from a personnel here at the records room at the General Hospital. But in all this is what the Ghana Health Service is seeking. Folders will phase out to make way for the automation system where patients would only have their details logged on onto a software. For Joy News, Matilda Famaga, General Hospital, Accra.
So let's hear the Sector Minister, Mr. Kwakwajima Menu, at the launch of the National E-Health Project is saying that it is in fulfillment of the NPP's 2016 manifesto.
The vision of e-health is well captured in the NPP manifesto. And so it is just a matter of time for the full potential of that promise to be delivered. On page 118 of the manifesto, the President and those of us following him assured Ghanaians that we will utilize the best of technology and health insurance management protocols to tackle waste, corruption, and insurance claim fraud under the National Health Insurance Scheme. This, we said, will include completely phasing out the manual processing of claims, which currently stands at about 90%. Tightly linking services and drugs to hospital attendance and treatment to diagnosis. Today, we are about to make this promise a reality based on experiences and lessons gathered through extensive engagements during the first phase of this project. The prospect of sharing patient information electronically with other healthcare providers within the safe environment is critical to measures aimed at improving patient safety and quality of care. Many of our doctors now hold accurate and comprehensive information about their patients that has been progressively built up over time. But unfortunately, these are held in folders that are currently stored in cardboard boxes and sometimes on corridors of our health facilities. In this day and age, when third-party involvement in healthcare delivery is creating serious legal demands on us, we need to strike a balance between clinical safety and consumer expectations and patient rights standards that are difficult to accommodate under the current manual system. The introduction of electronic health records, a key design feature of the system we are about to launch, provides an easy-to-use interface for doctors and other health workers to undertake their time-honored clinical and other patient management calls, like history taking, performing medical examination, assessing information, and requesting investigations if needed, then making diagnosis and deciding on treatment plans. The beauty of it is that all these pieces of information are stored electronically and can be accessed and shared through the electronic health.
Health Minister Kokwajma Menu there. The minority in Parliament is demanding that government withdraws the 2018 budget statement delivered to the House last week. Their argument is that the Finance Minister earlier this year revised revenue targets without parliamentary approval and went ahead to include those figures in the year's budget statement. More of that in our subsequent bulletins. Gary Al Smith and team are standing by with sports on the pulse. Please stay.